Good evening. This is the North Andover Board of Health meeting, Thursday, January the 27th, 2022. I'm Joe McCarthy, Board Chairman, and other board members that are here right now. Michelle Davis, she is the board clerk. Dr. Patrick Scanlon, he's the town physician. To my far left, it's Carolyn Lamb, she's the town nurse. Other members of the department, Brian LaGrasse and Steve Casey. Brian's the director, Steve's the inspector. So we have a quorum for the members of the Board of Health. And the meeting is open, and the first order of business is a Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. New business, the 2022 Board of Health meeting schedule. The board members, we just received it. We haven't had a chance to go through it yet, but that'll be done by the next meeting that we have. Moving on, communications, announcements, and discussions. And the meeting is really about the coronavirus. And in past meetings, there's always been other issues to discuss, such as approval of septic system upgrades, addressing housing issues, tobacco sales violations. But they are not on tonight's agenda. In a moment, Brian will review the coronavirus stats, and then Dr. Scanlon, likes to be referred to as Pat, will talk about his field observations and perhaps updated information on the coronavirus. But before I turn the meeting over to Brian, I just want to briefly comment on some personal issues concerning the coronavirus. Now, several weeks ago, I went to a rather large family wedding, and everyone at the wedding had to have before the wedding information on vaccination provided to the bride or negative test results provided to the bride. And again, this is a very large family wedding. It turned out to be, unfortunately, a super spreader, which has included my children, my grandchildren, my siblings, many nieces and nephews, and a lot of other people, two of whom, a daughter of mine and a niece of mine, have been hospitalized because of the virus. So I'm bringing this up because in the past I've been somewhat callous about it, somewhat nonchalant about it, but it's very real. And listen to primarily your doctor. Protect yourself. When I say your doctor, I'm not talking about the doctors on different TV channels that support the position of the channels. I'm not talking about the politicians. I'm talking about your doctor or other doctors that are reputable, such as Dr. Pat Scanlon here. So I'm bringing this up because just be careful. Just be careful. You only have one shot in life to die, and don't let this virus take you down. At that, I'm going to turn it over to you, Brian.
Thank you. All right, so we had a little holiday spike. Basically, it starts back in mid-November. The Omicron variant was first detected over in Africa. It then went through Europe, all the European countries, Asia, and the United States, and pretty much all over the globe. It was extremely transmissible. Luckily, it was less severe than the Delta, and there's some different theories as to why. One of the things that we have talked about, and I've heard from the state epidemiologist, Dr. Katie Brown, she said this seems to be, and I don't know if this is true or if this has been holding true since the last time she talked about it, which was about a week and a half ago, that this seems to be settling more in the throat than the nasal passage. So transmissibility from talking, laughing, hanging out with your friends and family. If you have more virus in your throat, you project it more. That's one of the things that was talked about. I know that Carolyn had some experience with having somebody test in their throat and tested positive and their nose was negative, which I thought was very interesting. So that might be one of the reasons why it's more transmissible, because of where it settles and how you transfer it to other people. It did come over right after Thanksgiving, which was literally the perfect storm and the perfect time for it to just transmit throughout the entire nation. Winter holidays, a lot of indoor gatherings, people relaxed with their masks and testing, and we saw the biggest spike we've seen since the beginning of the pandemic. That has since receded, and our numbers are back down to under 100 cases active in town right now, which we did see right before Thanksgiving and haven't seen that since. So that was actually really good news. Aside from the total of active cases we have, all of our numbers are dropping, which is good. I did give you guys the charts from that were published last week. I just literally was working on the numbers before the meeting to give you guys an update on the charts that I gave you. But as I said, our active cases are down to 99, which the last time we saw that was right before Thanksgiving. So
Maybe it's essentially being cut in half every week.
yes, yep. But going right on down the line with all of the other information and charts that we look at and we post on the dashboard, the 14-day positive percent positivity is down to 16%, which 8 months ago I would have said that is extremely high. But after seeing it over 20%, we are on the way down, which is good. After that, we go to the 14-day incident rate, and this is what the state does to basically give you a standardized number across the board for every city and town in the state. And we're down to 149.5 from 237.5 last week. So we're on the decline, which is fantastic. The 7-day went down a lot too, down to 86 from 155. Testing is still holding strong. There is a good amount of testing done in the area, which is good in terms of us having access to Lawrence General and the testing sites in Lawrence, as well as obviously other healthcare institutions we have in the area. And then Merrimack College still does testing as well. And the hospitalizations are also down to 2,500 across the state, which is down from 3144 last week.
Can I ask about the hospitalizations? Is this taking into account the new state guidelines of now separating people in the hospital, admitted into the hospital with COVID or because of COVID?
It is not separated out. I think this is still the same number they've been using, the same formula they've been using to calculate it out.
Okay.
Now, there is a big difference with that
Yes.
because there's a lot of, they call it
About
incidental.
About half of all
Really?
COVID hospitalizations are incidental
Yep.
with COVID.
Okay. Very interesting.
Just a brief comment on that.
Yep.
A week or two ago, Michelle Walensky, she's the CDC director,
Correct.
said that of people who have died, who have tested positive for the virus, at least there were other comorbidity issues, at least 4, if not more, for 75% of them. 75%. And I also heard on TV, well, so as an engineer, because I'm always thinking of numbers and so forth, I'm saying, well, what if you had no comorbidity issues? Would you die? And I heard a doctor on TV said, that number could be as low as 3%. Well, 3% of 870,000 people in the United States who have died is still a lot. It's about 27,000 people. So there's a lot of confusion out there, especially in that it hasn't been broken down. Did you die because you had the virus, or did you die with the virus? It's still under review at this particular time. I had read recently that the state is going to break that down going forward.
And that's what he was talking about, yeah.
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 Because there is a
They've
significant
done already.
difference.
There is a huge difference.
And also, too, on this list that you have here, the 14-day percent, or the positivity of test.
Mhm.
Certainly, Brian and I have discussed it, but for those who may be listening, people who take the home test, and correct me if there's been a change, correct me if I'm mistaken, but do not submit that information to the government, with perhaps the exception of several states in the nation, do not have to submit it from the perspective of the federal government or the local government. So we really don't know what the positivity rate is, because you have your home test, and there's more home tests than, I imagine, here you're talking about, what's it, the PCR test? Not the
This
home
is
test?
Yes, these are the tests that go to the labs.
Yeah, the
that
PCR test, not the home test.
Correct.
So the bottom line is we know what the results are from the PCR test.
Yep.
But we don't know what the results are from the home test. So we
Correct.
don't know what the percentage is. But it appears that the percentage is going down.
It is, and there's
Right-
other
right now.
factors that come into play with the state, obviously looking at different things. Granted, this is one snapshot, one piece of data that they do look at. So the home test that people are taking, some do follow up with PCR tests to confirm, which we do recommend. So if you have an at-home rapid antigen test that's positive, you want to make sure by following up with a PCR test. If people do call us and let us know, or they call the school because it's a child
That's a
or
different story.
something like that, then
Yeah.
actually that goes onto our master list.
Yes.
We do track those. Those are part of our numbers. However, but it's not on the state's number. It's not in their percent positivity.
Oh, a question too. So you take a home test,
Mhm.
and you have the blue strip, and I believe the red strip.
I think it depends
They're
on
all
the test.
different.
Yeah.
They're all
Oh, they're all different?
Yep.
Oh, okay. So, and I bought quite a few, an awful lot of test kits that I've given out to members of my family. At one time or another, they've been available across the street at CVS. I don't know if they have them right now.
I've seen them there. Yeah.
But it was a blue strip and a red strip. And some of
Didn't
my
say
relatives.
pregnant, right?
He didn't
Positive.
say positive or
Yeah.
negative.
It'll be very easy to disturb my train of thought, so I really don't want to go there. But some of my relatives have gotten bad, and they said, yeah, there was red, but you can barely see it. So does the color fade as you get better, as you're recovering
I
from
don't
the
believe
virus?
so. No.
No.
It's
No.
not.
It's
I
still
can tell
considered
you,
positive.
I had a family member who I literally could barely see it, tested positive PCR next day.
Ah,
Yep.
Yeah. So-
interesting.
Yeah.
So don't, when they say faint,
It's
It-
positive.
If it's there and you can
It's
see
there.
it, then
yeah.
you're positive. Or depending if it's one line, two lines, red, blue, whatever
Yeah.
the test specifies is the legend, positive or negative, just go. If you see it and that's what it is, then go by it. Or follow with the PCR test the next day. We do like to tell people that if you do test positive on an antigen test, don't go out for your actual test the next day. Stay home, isolate, get tested, wait for those results, and then see what they are.
So I believe if you have the PCR test and you're quarantined for, I believe, 10 days.
5 days.
Is it 5 days now?
That's a new change, yes.
So if you have a home test after that 5th day and it comes out positive,
It's
can
not
you go out?
recommended that if you still have symptoms, then no.
I was going to get into that later.
Yeah, I'm getting carried away. One other thing here too.
Okay.
On what you handed out, this, the deaths in North Andover from people who had the virus. not because of the virus. Not necessarily because of the
And
virus.
there's
But there's
just-
about 100 in North Andover.
Yes.
An awful lot, but not one is under age 40.
Correct.
And there's only a few between 40 and 50, and the vast majority of them are people that are very, very old. So that brings something else up that you two may want to further discuss. If people aren't dying under 40 years old, and the percentage of people in our schools is above the minimum to not wear masks. What's that, like 75, 80%?
80%.
80%.
For certain
80%.
schools, staff and students.
So are they wearing masks in school?
They are still wearing
They
masks in school, yes. The school department, the school committee passed a policy for the district that does require all students to wear masks in schools.
It had been January the 15th, so apparently they extended.
They extended that
time.
to the end of February 28th, I believe, yeah. So that's on the books until February 28th. They are reviewing it and looking at it. I have met with the school department. We meet every week. We talked about it today. Things are moving forward. Our numbers are going down. Right now, they have a first read of a new policy that may allow schools over 80% to remove their masks. But that is all being debated now. It's just up for discussion. And they will move forward with it eventually. But I'm not going to speak on that. They're actually having a meeting tonight, too, and they'll be talking about it.
One thing, can you comment about with trending the numbers, about the wastewater detection within the
Yes.
state?
Yep, so MWRA, Massachusetts Water Resource Authority, has been doing ongoing sampling of wastewater and detecting or analyzing it for concentrations of COVID, the actual virus. And that's a clear indicator, depending on where you are, well, no matter where you are, it's a clear indicator as to what the trends are. So it doesn't matter about who's testing what, whether it's at home, recorded, not recorded, PCR, your friend's house test on a Friday night for fun, whatever. The MWRA is sampling all the wastewater for the entire region, and the concentrations are going down dramatically, which is a clear sign that the numbers are also decreasing and reflecting in the wastewater.
And that's a good test. That's the wastewater going to the plant,
Correct.
not the wastewater coming from the
would
plant that
hope
has been
not.
treated. So just want to make it clear, because when I looked at it, I'm saying, well, is it to or from? And
Yeah.
and indeed,
Yep.
it is to.
Yeah, so MWRA is doing the testing. They have seen a decrease in that. Another thing the state has been analyzing is absenteeism in the hospitals. Absenteeism rates are dropping, which is another indicator that more people are going back to work. They're not sick, they're not isolating, they're not quarantining. Vaccination rates are up, which is also helping that. As a town, we're doing really well. We are at 76% fully vaccinated, and
Do you mean fully vaccinated is 2 shots right now?
correct, still 2 shots. Fully
one
vaccinated,
Johnson?
76%. I mean, yeah, 76%. Partially vaccinated means 1 shot is 85%. So those numbers are up there. We did have a clinic today at the high school cafeteria for students. Originally it was opened up only for students. That filled up. They were able to get more vaccinators to commit, so they opened up more slots. We opened it up for boosters as well. I haven't talked to Greater Lawrence Family Health Center tonight. The clinic was going until, I believe, 6:30. So I will get a report from them and talk to them hopefully tomorrow, find out what the number they did, and I'm sure early reports that they were having success and things are running really smoothly. So I didn't get a chance to go over today. Caroline did talk to them, and I'm happy that they were able to come and set this up. I'll let her talk about future clinics going forward in a little bit. The number one thing is vaccination is the key to this. I think it's been proven through and through that if you get vaccinated, no matter how old you are, it does help. It does reduce the symptoms. It does expose your body to the virus before you actually catch it, which gives you the ability to fight it off without your immune system overpowering your own body. So I'll let you talk about that more. That's definitely more up your alley than mine.
But before you, I just want to stay on that subject just for a moment
Yeah.
before we turn it over. Patrick, and this is a question actually to all of you. In today's Wall Street Journal, there was an article. It says the high cost of disparaging natural immunity. And let me just read 2 quick paragraphs, because I have some questions on this. It says, last week, the CDC released data from New York and California, which demonstrated natural immunity was 2.8 times as effective in preventing hospitalizations, and 3.3 to 4.7 times as effective in preventing COVID infection compared with vaccination. There is another study from Israel that says that natural immunity, so if you had the coronavirus and have recovered from the coronavirus, your natural immunities give you 27 times as much protection as an in-depth article that I read from Israel as the shot, as the virus shot. So it says to me, and the politicians, it's all over the place, it says to me that if you have the virus, you have natural protections, you have built-up antibodies, why be vaccinated? It is a question. You know, as an engineer, I'm looking at it from a statistical perspective, and it just doesn't make that much sense to me to be vaccinated if you have this greater measure of protection, haven't had the virus. But I could very well be wrong. I just don't know. And by the way, I don't believe what the politicians say. At all.
I'll take a
for
quick-
how long?
Yeah.
At all?
What is
Yes, it does. It
I'll
says
take
for
a
how
quick
long.
stab at
Yeah,
that. All right.
it says the protection is up to 99% for 2 years. I'll give you the article here.
So I'll compare it to a flu, okay? So the flu virus we see every year, okay? It changes and mutates and comes up with new strains, and it goes across the globe every year. Every year we get a flu shot to help you protect yourself against the predicted strains of flu that they think are coming. And they do a quadrivalent, that's like 4 different strains in there. What you're doing is you're giving your annual flu shots like a flu booster, okay? So they talk about waning immunity with this. As you get your vaccinations over time, your immunity does go down. It decreases, it wanes. Same thing with the flu. You get a flu shot every year. It's new strains. It boosts your immunity. You build antibodies, and your body's that much more ready to fight off a new strain of flu, or the strains of flu coming around. Coronavirus, if you catch it, call it comparatively to getting a vaccination. Over time, that immunity does wane. Your body doesn't build up as many antibodies as time goes on for that particular virus. So what they're doing now with the coronavirus is issuing boosters. Same thing. So natural immunity or vaccination over time does wane, and you're more susceptible to a higher prevalence or severity of an infection. Is that close?
I don't have any further comments.
And here's another, well, speaking of the element of time, you know, how long are these vaccines or natural antibodies built up in your system good for? The article is by Dr. Mawari. He's a professor at Johns Hopkins School of Medicine. And what he said, amongst other things, is the Moderna vaccine against infection, not severe disease, declines to 61% after Delta and 16% after Omicron, whereas the natural immunities still are in place up to 99% after 2 years. So, whoa, this may be a misprint, and if it's not,
I don't know if they've had
need
long
to
enough.
Yeah, I need to see the actual
yeah.
studies. I mean, and that's an opinion article too.
Yes, it's in the opinion
So
section. You are correct.
I need to see the actual.
I'm doubtful
data.
of it too, but I also feel that perhaps there's a measure of truth in this article.
So, kind of going with what Brian was saying, though, you know, we're also not saying, oh, I got the flu last year, I don't need to get the flu shot this year. Which kind of just goes to exactly what Brian is saying, that, you know, having these, as we're looking forward, hopefully, we're getting into the endemic phase of this pandemic, is that these boosters are just going to be boosting your immunity with the goal of that, God forbid, you hit that age where you're now considered high risk for hospitalization or death, that extra booster shot is going to give you that extra immunity regardless of whether you've had it. I mean, I know plenty of people that have had COVID twice now, too.
Yeah.
I mean, they're young.
Yep, I've heard of multiple people getting it twice.
But why? It still boggles my mind that why all of a sudden with this pandemic we're questioning vaccines in general now. You know, do we hear people sending their kids to chickenpox parties anymore? No, because we have a vaccine for it.
Well, the article's
Right.
not questioning vaccines, but it's saying that natural immunity appears to be better than the vaccines.
So then why not send people back to chickenpox parties as opposed to give them the vaccine when they go to the pediatrician's office? You know,
I can't comment.
But that's.
I've had, I mentioned earlier about this wedding that I went to, which is a super spreader of the virus, and several people, one of my daughters included, have been hospitalized because of that. So I, as so many other people, have tested on a very regular basis the last 2 weeks or so. Fortunately, it's always come out negative. But I'm saying to myself, do I really want it to be negative? If it's the Omicron, that's what a lot of people are saying. Because if it's positive, it means that my antibodies would be built up, and I'd have that much greater protection against the next variant that comes
But
along.
you're vaccinated.
You can do that with a vaccine too.
Yeah, oh yeah, and plus a booster shot too. So I was a little bit disappointed when I said, when I saw that a negative reading, and I know I'm not unique, but it is what it is. Yeah, so.
I mean, you could still, 100% you can still test positive with, and this is still for some reason not getting out there that you can get COVID being fully vaccinated and boosted. And that the vaccine was never ever designed to prevent infection. The vaccine was only designed with one main goal in mind: prevent serious illness
And death.
and then the secondary benefit is to not overwhelm the healthcare system in this country. And we're being overwhelmed.
Yeah, now that I'll turn the meeting over to you. So tell us what's happening in the hospital.
Yeah.
Well, I had a conversation today with a patient, and I talked about the vaccine, and I kind of described it as, so it's twofold, because, you know, and they rightfully admitted that there's so much misinformation out there on so many levels, and social media feeds it, they don't know what to believe. And so I said, you know, getting the vaccine is twofold: to protect you, to protect others. It's a public health issue, and as citizens of this country, we should be abiding by or caring for other citizens that are around us, which is why we should be getting vaccinated. And I kind of drew the analogy of wearing a seatbelt in the car. It's a law to protect you, but also to protect others. One example, and I'll go back to my firefighter paramedic days, of, you know, you're driving in the car, and you're a unrestrained driver, and you hit a curb, but you're going at a high rate of speed. One example. That, if you're not wearing your seatbelt, you can kind of get thrown out of that seat a little bit. You lose control of the car, and then you hit and kill somebody or injure somebody else in another car. So the design of a seatbelt is to protect you and protect potentially others. So I kind of drew that same analogy with the vaccine. Because you don't know who you're walking by, you're decreasing your rate of transmission to other people with the vaccine, and you don't know if, the 29, 90-year-olds that passed away in North Andover, that if you could have transmitted it to somebody else, but the vaccine, will reduce that risk. And you hear all these stories over the last 2 years of, people say, you know what, I know that COVID was here in March, but I felt like I had it in December. Oh, who knows when the first actual true case came in. But it's, just the rate of transmission is substantially decreased with the vaccine, and it's a public health issue on so many levels. All right, that's my soapbox rant.
A question.
Thank you.
If you had the coronavirus and never was tested, and I wouldn't be surprised if I had it like a year or two ago, would a test, say an antibody test, or any other test, tell you if you have ever had that virus?
So you don't know.
You don't know.
The bigger question is what's the level of function of those antibodies that are being tested? Are they 10% effective? It doesn't test the strength of those antibodies. So I think where I was kind of going, and I lost my train of thought, was that, somebody who got infected early on in the pandemic, okay, and they recovered, because the initial studies coming out saying that people who had COVID and were critically ill and recovered had much more of a longer antibody response after their recovery than somebody who had mild illness. Again, this was all before the vaccine. But unfortunately, I don't know anybody that had the critical illness in the beginning, and then now with Omicron, did they get reinfected? Or did they get the vaccine somewhere in the middle? So I don't know what the level of antibodies that they had in the original pandemic phase, the initial wave, and they recovered, and then if they got the vaccine or didn't get the vaccine and then got Delta or Omicron, how did they fare? Because they can 100% been unlucky enough to get the first strain, get Delta, and then get Omicron. You 100% can get all three. But what is the severity of all of that? That's really what we care about, and preventing people from being in the hospital and preventing people from dying. That's what we really care about.
If you remember the initial stage of the pandemic, it was a novel coronavirus we had never seen before. We had no immunity, we had no antibodies, we had no vaccine. That's what is the biggest crux of the issue, is when that happens, you don't know what's going to happen. You don't know how the population is going to react to a new virus. H1N1, bird flu, swine flu, those were novel strains of flu that we'd never seen before that could be a severe issue. They weren't, and they were mild, thank God, but you don't know. So when the coronavirus came around and it was a new strain of coronavirus we'd never seen before, you don't know how it's going to react. The initial populations that got it were having a hard time. The hospitals were overrun in Italy. It was extremely scary. But today where we are, with vaccines, with the population having some natural immunity, we're getting past pandemic and it's now becoming endemic. The state is shifting to that model as well. It takes a long time to change from pandemic to endemic, but there's no eradicating COVID. There's several strains of COVID already out there prior to the pandemic. This was a novel strain. Now it's learning how to live with it. That's where we're at now, because the initial thought of getting rid of it, like smallpox, didn't happen. The lockdowns, everything going on, vaccine was created, and now we're getting past that stage. So
It appears that people are taking this a lot more serious now,
Yes.
too, than any time in the past. Like, for example, you shop at Market Basket or Stop and Shop, and virtually everyone there is wearing a mask right now. Several months ago, I did not see that. So People are taking it serious. But speaking of masks, are these masks any good? What I read is they're not. These are cheap masks. Do we need them? We're wearing masks because we have to. But are they any good?
Do you want to take this one?
Go ahead, you can take that one.
It is a mitigating factor, and it does play some role in reducing transmission. Now, since
But it's better than nothing.
It's better than nothing. Since the beginning of time,
Fine.
surgeons have worn masks. It wasn't necessary to protect the surgeon, it was to protect the patient while they were operating on them. So by me wearing a mask and me breathing into it, any droplets that I have may be caught, or percentage may be caught by the mask versus becoming aerosolized into the area around you. So what's the percentage of filtration? I don't think there's any effective study that could ever tell you. But do you see reduced transmission rates? Yes. From day one, with the kids wearing them in schools, no matter what state you were in, no matter what state of lockdown your state was in, schools were safe, kids were sitting next to each other, they had masks on. It was a very controlled environment, and it did work. So by at least having some mitigating factor, ventilation, masking, things like that, there was success. I know some private schools that had their kids in school all last year, 5 days a week versus hybrid models, and there was no huge school outbreaks. There's a bunch of Catholic schools in the area that went to school 5 days a week, no issues. So it did help, because in an indoor environment without a mask on, and the perfect example is an indoor gathering. Christmas dinner,
Like a wedding.
wedding, funeral, Halloween party. We saw some spikes after Halloween for some parties that were in the area that we actually saw huge numbers from those parties. So masking does help. It does help contain the aerosolized particles a little bit than not having it at all.
Any idea how much longer we'll have to wear masks if we come to town hall?
Not sure. The numbers are going down, which is a good thing. We're going to monitor our case numbers in the town as well as the region, percent positivity, and obviously hospitalizations, and see what the healthcare system is doing and how they can handle it. So a lot of input goes into that before any decision is made. I think we're getting to that, yes. The numbers are going down dramatically. Last spring, the numbers went down, things opened up, restrictions were lifted, mask mandates were lifted. Even last year, summer school, kids weren't wearing masks in school. So, but the numbers were also very low. So as things trend downward in the right direction, vaccination rates go up, it does open it up.
Well, speaking of numbers turning down, which is terrific. Last month, Pat, I know you and Dr. Max Tilson, you're commenting about the problems in hospitals being overloaded, people leaving, people overwhelmed. What does it look like now compared to a month or so ago?
I mean, a month or so ago was, I'd say
'Cause
probably
that was
about
bleak a month
three.
ago.
Probably about 3 weeks ago was probably the peak of hospitals being truly backlogged. I know Lawrence had up to like 40 people waiting in the ED to get to an admission bed in the hospital.
Wow.
So it was bad. The one thing I will say is that the big difference now is that there are much less people taking up ICU beds and being put on ventilators from COVID. That I really believe has to do with the vaccination rate, because there was several weeks in a row that it was basically 100% of the patients that were in the ICU with COVID, like because of COVID, were unvaccinated and seriously ill enough to be in the ICU. But I will say that that is dramatically different than what it was during the first wave where the only way you can get into an ICU is by somebody else dying and taking over.
You're talking
that
about a year and a
ventilator.
half or so ago?
Yes, yeah. So I think the vaccines have clearly done their job. And, you know, Omicron is definitely I do believe it is a less virulent strain overall. But that being said, there were definitely people dying from the Omicron variant as well.
A question to you, Brian. The governor said that 2 million test kits will be distributed, and this is as of several weeks ago. Do you have an update on that at all?
Those were distributed to higher risk communities
I'm aware of that.
and already
but-
given out.
But I thought that there'd be some that would be available other than in the higher risk communities.
The federal government did step up and did create an online ordering form where you could order 4 test kits per household.
Really
It was
easy.
through USPS.com. You click on it, you put in your name and address, and you hit order.
It
Boom.
is so easy. I've done that. The problem
Yeah.
is that they're not going to be here for a while. And by the time we get them, simply the Omicron variant of the virus will have further subsided.
That's okay.
It could
We'll
be
still
replaced
get
by
'em.
another one, I don't know, but they won't be available for probably at least a few more weeks. So we'll see on that. But yeah, it's very, very easy to order.
Yep.
I ordered
Yeah.
I ordered 4 with these.
Okay, good.
Yeah.
Are the kits, I haven't been to the drugstores recently, can you get them more readily now? Are they, have anybody?
Amazon.
It's
Yeah.
like periodic at the stores.
Yeah.
and then-
Exactly.
Yeah.
Exactly.
So they come in and they sell out. They come and they sell out. It's a cycle.
About 2 weeks or so ago, across the street at CVS, there was a line that was almost outside the door, and I said, "Oh, I bet they got masks in," and excuse me, the test kits in, and they did. They had pallets of test kits in, but you can only get 6 at that time, and well, I think it was 6, maybe it wasn't, but they went fast.
It was something. Yeah, it was like 6 at CVS,
Yeah,
I
but
believe. Which,
they went real fast, and they got them in several times since that time. I've even asked, when are you going to get them? And they said, we don't know.
They just
We
show
don't know.
up.
They just show
Yeah.
up.
But I mean, I've
They
ordered
show
some
up.
on Amazon. I know a lot of other people, they
Did you
actually
get 'em?
are coming earlier for
Yeah.
a lot of people. Like they give you like a worst case scenario, I think, with the dates, but a lot of times they're
Okay.
sending them earlier. So, yeah, I got mine, I think, 2 weeks earlier than they said I was going to.
Oh.
So yeah, so they are available. You just have to find them. I was told by somebody that if you drive further up into New Hampshire, they had them everywhere. Southern New Hampshire sold out.
Really?
Go a little bit further up and you'll find them.
The one
That
other-
was like 2 weeks ago.
The one other thing I wanted to point out is the website that the state created to be able to get your vaccine card on your phone.
Yes,
Um,
it's very close.
Yep.
It's so quick, so easy, and it's on your phone.
And you get your flu, all your flu.
Yeah, my
as
flu
well.
shot came
I
out,
was like,
too.
this
Oh,
is
nice.
great.
Yep.
Yeah.
Yep, I did a.
Well, I tried it as soon as it came out, and I was unable to do it. So we don't want to
That
go
might,
there.
yeah, that
right
might be user error.
So yeah, 2 things I was going to talk about tonight, which was the free tests. I talked about it on NACAM today with Melissa. We did a little blurb to get out there. The USPS.com has the 4 free tests per household, as well as is it My Vax Records or I forget the
Is
website.
that
It's on here.
for household or,
4 per household.
oh,
Yes.
I thought it may be 4
And they do
per
do,
adult.
like, my wife actually ordered it, and I didn't know she did, and I tried it later on that day, and it actually will say your household has already exceeded the
Oh.
limit.
Okay, yeah. So you can get your vaccination records online. Go to mass.gov. There's a link for it to find my vaccination records. It's like myvaxrecords.com or mass.gov. Super easy. Go on there. They send you a link. You can download and print out your vaccination records. It can also get you a QR code for your phone that somebody can scan and it brings it up. So
When I did it, it said your information is not available. At least it didn't say you don't exist. That would have been a real problem. But
yes. So going back to vaccinations, I'm going to pass it over to Carolyn for a minute to talk about what you've been working on and kind of take it from here for a minute.
I still have a ton of flu vaccines that I'm willing and ready to give out. It is still flu season, so I have a ton of those ready to go. Ideally, my next plan is I ordered 100 Moderna booster shots. I don't know when those are coming in, but hopefully have a booster clinic at the senior center sometime, hopefully within the next month. And then moving forward, hopefully get into the schools and boost some of those children or do first and second shots for them. The high school is above that 80%, but not all the schools are, so hopefully we can get the vaccination rates up in the schools.
Do you have to make an appointment
For
to
the
get a
flu
shot?
To get the flu shot?
Yeah.
No. Just give me a call and we can do them.
Maybe we'll set something up. We can do a small clinic on a Friday morning at the senior center.
Absolutely.
Maybe talk to Kathy, see if there's any interest. Get something on social media, and just do a quick, easy, 2-hour morning clinic just to see if we can eat some.
Flu is still here.
Try to get some of those flu doses given out. All right. Obviously, the number one thing we can do is push vaccinations. I think that's where we want to try to switch our focus to. The state did away with contact tracing. We've been doing it for the most part on our own and with the school nurses to work with the school-aged children and school-aged population. But they are still basically stating that we're switching from more an active participation in this to surveillance and monitoring clusters and things like that. So we're shifting from pandemic to endemic at this point. People just can't keep up with the full-blown contact tracing and case monitoring that we were doing, especially when we were getting 100 cases a day a couple of weeks ago, which was insane. The state also did change their isolation and quarantine guidance. As you know, before, isolation was a strict 10 days no matter what. Now it's down to 5. Quarantine, there was some fluctuation between 7, 10, and 14 days. That's also down to 5. So isolation for people who test positive, 5 days. If you get your tests on Tuesday, that's day 0. You get your results on Wednesday, that's day 1. 5 days, stay home, don't go out, no sports, no book club, no girls' night out, whatever it is. And then on day 6 through 10, wear a mask whenever you're around somebody. That's to try to help curb any spread on the back end. So what they've been saying is when you are exposed to the virus, it may incubate for a few days in you, and then eventually you'll test positive or show symptoms. You're infectious up to 2 days before you show symptoms and probably about 3 days after you start to show symptoms. And that's your highly infectious period. Obviously, there's a bell curve and people can go longer. So at day 5, if your symptoms are resolving, your body's fighting off the infection, you can end your isolation, especially if you have no fever. If you have a fever, wait 24 hours until your fever is gone, or fever's been gone for 24 hours, then you can switch over to the next phase and just wear a mask for another 5 days. Quarantine is for people who are exposed to somebody who's positive, but you don't necessarily have the virus or you're not sick. You need to quarantine, which is wear a mask for 5 days. If you have symptoms, get tested. It is recommended that you do get tested after 5 days, and then wear a mask for an additional 5 days through the 10 days. So, any corrections, any additions to that on the quarantine? We're still getting, they've changed it so many times. All right.
I had heard, and I do not know if it's true or not, that the PCR will even test for dead virus.
Correct.
Up to 90 days
Yep, that is true.
after you have been infected, the results could still be positive.
Yep.
Comment.
Yes, that has caused some issues in the hospitals, particularly that patients who were there and need to be transferred to, like, for instance, like a rehab facility to get more strength back after the hospitalization. A lot of the rehab facilities, I think, now are shifting what their testing is, that when a hospital considers a patient COVID recovered, they're still requiring a PCR swab to be able to transfer a patient to a rehab facility, and the PCR comes back positive, and now patients can't leave. But it doesn't mean that they're infected. It's just you're still detecting dead virus remnants of the virus's DNA. So that is correct. Of the at least 30 days after infection, and patients are not infected anymore, but can still test positive by PCR.
So you can test positive for the PCR, but you can test negative for the home test kit.
Correct. So when a patient's exhibiting symptoms of COVID, the home rapid antigen tests was new data saying that now it's actually close to like 99%
Really?
effective. Yeah, I think it was low as like 94, 95% or something like that originally. But if you're showing symptoms, it's 99% sensitive.
So
and
if
specific.
it's 99% effective, why bother taking the PCR test?
So I haven't been telling any of my patients to go out and get the PCR. If your antigen is positive and you have symptoms, to not go get the PCR. But and I do have patients that will go and get the PCR afterwards, and it's positive.
And particularly if you
as
can't
well.
get a home test kit, you go, oh, geez,
So
I'm
that's
not doing
yes,
good. So
then
I'll have a PCR and it comes out positive, but you may be okay.
Some people like to confirm the rapids
Yes.
because they weren't there was a question about the accuracy at the beginning. What we've been told by Dr. Brown is the antigen tests aren't as sensitive on the front end or the back end. So the window where you test positive is smaller than the PCR test. PCR test might detect it before you're actually shedding the virus. If there's anything in there at all, it may come up positive before the antigen test would come up positive. PCR is also more sensitive after, when your body's already fought the infection off, and you still have dead virus particles in your nasal cavity and in your body, versus the antigen test won't detect all of those. So you become negative quicker on the back end and later on the front end. But when you have symptoms, you're infectious. You are shedding the virus. 99%, it's 99% accurate at that time, which at least it's something. Having testing that available, so you know what you're dealing with.
And I think as we shift towards the endemic phase, a lot of these PCR testing sites, like the one that right by Lawrence General, I mean, who knows how much longer they're actually going to stay open, and they may shut down, and it may just shift to home testing when you're symptomatic.
Yeah, or go to your pediatrician or go to your doctor. They can take a swab and send it off to the Broad Institute and get your PCR test done the next day, versus at the office with an antigen test or at home in your kitchen.
Well, and for so long, everyone had to show these PCR tests to everybody, so it was like driving the testing everywhere, because that's what was required to, I mean, still travel and stuff like that. I mean, as long as that's out there.
Yeah.
Yeah.
Yes, that's true.
And Aruba just changed their testing requirements so that if you are fully vaccinated, you don't have to test to go to Aruba.
It's still that test coming back into the country, though.
You have to test to come back, though?
I think the U.S. yes, but Aruba says no. To go there, if you're vaccinated, show proof of vaccination. You don't have to test when you get there.
It's the test back that just gives me the heebie-jeebies.
I'm supposed to go to Puerto Rico in a couple weeks, which is the United States.
You don't have to.
No, we have to test to go.
Really?
What?
48
But
hours.
not to come back.
Not to come back.
That's the same, because you think about it.
So
you
that's
test
why I'm like.
positive and
Yeah.
have to quarantine in your hotel room with 2 young kids for 11 days or whatever.
It's not
That
in
gives
your
me the
hotel room.
heebie-jeebies.
But it's not in your hotel room. A lot
Yes,
of
you
places
got Airbnb
go
or something like that.
someplace
Yes,
else.
it's
Yeah.
someplace else.
Yeah.
Yeah.
That's funny.
You don't get to sit in a beautiful resort with a nice view, I don't think.
True. So things are definitely changing. Things are shifting. Our holiday spike in peak and the Omicron peak coupled together is now on the decline, which we're very happy about. Severity is down, which is really good. We're getting there. Vaccination rates are up. We're plugging away every day, talking to residents and working with the schools and regionally and other departments in the state. So it's been a long couple of years, going on 3 at this point, right?
Well, thank you. That's been a very good review and input, certainly much appreciated, input much appreciated
Yeah.
from all of you. Before we adjourn, two other brief matters. Animal regulations, which we did discuss briefly the last meeting or two. They're being worked on right now,
Correct.
not complete.
Put them on the back burner with everything going on over the holidays.
As it should be.
I've been trying really hard to get other stuff done.
You know, I can recall when I was re-elected as the chairman in June.
Yep.
You know, I said, these are some of the things we want to work on. Well, guess what? We haven't.
We've
You
done
know,
some work, but
Well,
not enough.
We have, but you know, the focus, as it should
Yeah.
be, has been on the coronavirus. And again, I listened to a lot of board meetings throughout the Commonwealth of Massachusetts. You can listen to them on the Board of Health meetings, and I'm very impressed with ours because our focus is not only what's happening in town, you know, but what our doctors and others see in the field
Yeah.
right now. And I've got some really good feedback
Okay.
on that. So thank all of you. One other point, and then I'm done. The needs assessment plan. Comment?
It is.
It's in the package here, I see.
It's in the package there. That's the Health Resources in Action write-up as to what they would be willing and able to do. Just for you guys to review what we've done, we set aside some ARPA money to help fund this. We have also partnered up with Andover to do a by-town assessment because our populations are very similar, so we can double up and save some money by combining some of the outreach and some of the data collection. So this is just a proposal. What's going to happen next is it's going to go out to bid for an RFP. It's a request for proposals. So any company can put in a bid, and then we'll go through those bids and we'll choose a company to do a community health assessment. These are pretty in-depth projects. They take a year to do, but they give you data and community input about what your residents think they need, what they want, and what the data we can get and obtain is telling us, and create programs and outreach to meet some of the needs. These things are great to have. They give us a blueprint as to what we can do most effectively moving forward as a public health department and try to tackle some of the issues. So this is the proposal they gave to us. We've been trying to get to it and trying to get things rolling with it. It just, COVID just has not let up.
Do that?
Excuse me?
Do you have the staff right now to do that? The people to help?
Well, that's this company. It's a nonprofit agency that's going to do
But
it.
you and your department will be working with this.
Of course,
company.
absolutely, yeah.
So I'm just wondering if you're properly structured and set up to do that.
Yeah, I want to make Carolyn do the whole thing.
Good for you, Cal. Great, great.
Kidding. No, we'll
You
definitely.
still have part-time helping assistants? in
We
your
do.
department?
We still have nursing help, and we do have an additional inspector, Laura, who's been. They've all been tremendous with all of the work that's been kind of sent our way. We've been managing, but the additional staff has been key.
Ooh, one other point. I'm aware that earlier this week there was an oil spill
Yep.
on right off of
Foster Street.
And I think it's like 800 gallons of oil ended up in Mosquito Creek or pond or river, whatever it is. And
It was Mosquito Brook. Yeah.
yeah, and that ends up going to the Ipswich River. Has been properly cleaned up. I know you are aware of it,
Yes.
but what's an update on that? right
DEP runs point on hazmat. We're in the loop, of course. So what happens when there's any type of a spill over 10 gallons? You got to call DEP. It's an emergency response crew out here. Whoever is the responsible party, it's and they get an NRP, which is Notice of Responsible Party. They're in charge of the cleanup under supervision from the state. So DEP has, it's called the MCP. It's a Massachusetts Contingency Plan for any type of hazmat release. You've got to follow that by a book. You've got to hire a company that's got an LSP, which is a licensed site professional, that are certified to run and manage spills or contamination cleanup. And you got to do a tier classification. You've got to clean it up. You've got to submit your reports. There's a whole regulation in the state that they have to abide by. It's very complicated, but it's very in-depth, and it's very meticulous. So they're working on it as we speak. They've been working on it ever since. They're going to be filing the reports and doing all of the soil sample collections and analysis to see how far the plume went and to remediate. Now, what that looks like, I haven't seen any diagrams or I haven't got any reports yet on like the size of the plume, how far it went, what's involved. But something like this is mostly surface, which is good. It's when you have an underground storage tank at a gas station that leaks for years where it becomes a huge issue.
Plus the brook is probably frozen too, so it'd be on the
Yeah,
surface.
it's mostly frozen.
Yeah.
Yep. So yeah, they've got to do a tier classification, immediate response action. They're going to do a phase 1, phase 2, phase 3. These are all steps DEP mandates. So it's unfortunate. I know where this was. It's obviously, you guys know Foster Street. It's not the easiest road to navigate if you don't know where you're going. Tight turns, but yeah. So DEP is running point on this, and they've had to hire Clean Harbors
Clean Harbors.
is out there, basically telling this company what they have to do and just doing it.
Anything else?
Steve, you got
I
anything?
Like one thing real quick. Like Brian said, they have changed a lot of the guidance and stuff around COVID pretty frequently. We did make a flow chart for the new guidance just to kind of clarify some of what the state has in writing, and I think it's on the website.
Yes.
So if
We
people
sent-
have questions, they can. Yeah.
We sent this out and did the write-up as to the changes in isolation and quarantine on December 29th. That was 2 days after the state dropped the bomb on us. And right before New Year's. The dashboard, I update the numbers every week. I started them today. The state doesn't come out with their information until 5 o'clock on Thursday. So I've got to take their information and our information, merge it, get it in this, and I usually do it. It takes me a couple hours, 2 or 3 hours on Friday morning to get it out. If you guys have any recommendations or any opinions as to what I should add or subtract or change, let me know. I just started pulling together information that people were looking for, and people kind of get used to it. I did have somebody email me asking for various vaccination numbers at right afternoon, about 12 days ago, and we were in the middle of everything. I didn't get to them for like 6 days, and they blasted me on Facebook. So I'm doing the best I can.
You're doing a good job.
Thank you. So it is what it is. But if you guys have any information you want me to add into this, if you want to do a little blurb, let me know what you've seen in the hospitals. I can add that to it too, to add more work to your high-paying job.
No problem.
But yeah, so anything else you guys want, let me know. I'll get this out tomorrow.
And then new testing so schools will no longer be test to stay.
Correct. So the schools and DESE are switching gears here. From the test and stay program, which was if you're a close contact in any school setting, you would then test for 5 days in a row at the nurse's office. So before you go to class, you go to the nurse's office, you test, wait your 15 minutes, see if the test comes back, and whenever it comes back, then you're free to go to your class. They were doing, and the tests that they did were 99% negative. So they were only catching a few here and there that would pop up positive over the course of those 5 days. They're now switching to a weekly testing program at home, on your own, opt in if you want to. They will give you the tests. They'll give you one box, which is 2 tests every 2 weeks. You can take it at home. on whatever day they determine. I believe they're thinking on Fridays, but I'm not sure. Just if anybody tests positive, they want to try to limit and reduce the number of days you miss school, because you have to be out and isolate for 5 days. So there's debate on what and when. So we'll see how that works out. But yeah, so 1 test per week, anybody who opts in, students and staff, instead of the test and stay program. And they're ordering them now. The teachers are going to get theirs next week, or they got them this past week, and the students are getting them next week maybe.
Yeah, we just got the forms this week.
Okay.
Yeah.
Okay. Yep.
Yeah.
So shifting from, and they'll actually be able to do symptomatic testing too. So before, those tests that they had through DESE were not on lockdown, but you had to account for your tests, and you had to meet the criteria to test somebody. Now, if they have extra tests, they can test somebody who's symptomatic, which is what we want to shift to, because these are great for symptomatic people. So yeah, we'll see how that goes. That's just starting up. They've already gotten, I want to say 1,000 to 2,000 people have already signed up for it.
Wow. Oh, wow.
So, good.
I have to say, it's one of those things at this point, I'm just like, anything that comes in, I'm like, opt in, testing, vaccination, go ahead, bring it on, opt in.
Yeah. But yeah, they're talking about that tonight. They did get their letters out. I think there was some confusion
Yeah.
when people
I
first.
don't think most of us knew what we were actually setting up for. Somebody actually said to me, "You're doing the weekly testing." I go, "What? Is that what?"
I guess I am. Oh, that's funny. Anything from your end over there?
No, I mean, we had the same thing going on with absenteeism and starting to see. I mean, again, remember, my team works in the south, so I feel like what we start seeing up here takes a little bit longer before I see it down there. So we're still having quite a few people out testing positive, but yeah, less hospitalization, so positive
good.
things. Yeah.
And this is what we've seen overseas as well. The dramatic spike, and then it just falls off a cliff, which we're 3 to 4 weeks behind England. I know some other countries over there have removed all restrictions completely. I don't know if that's where we're going. We might take some time to get there, but if the numbers keep going down like they are, vaccinations are happening on a regular basis, vaccination rates go up and up and up, I think we'll be in a really good spot. And that's what we've been striving for. I wish people got the vaccine when they could, right off the bat. I've heard of multiple stories of people in the hospital saying they want the vaccine and like it's too late.
Yep. 100% true.
Yeah, which is too bad. They knew ahead of time. Get vaccinated. It will keep you out of the hospital. And on the dashboard, I do post those numbers as well. The breakthrough cases and how many of those go to the hospital and how many die. And it's such a minuscule percentage. It just makes sense.
Brian, Patrick, any other variants to be concerned about going forward, or is this just the latest, the Omicron?
The latest one, there was the Omicron.
B2?
Yeah, that apparently is here, but I don't think it's anything that's significant, probably similar to what Omicron.
If it's still called Omicron, it's close enough to the original Omicron strain.
Exactly.
They didn't rename it. It didn't get to a new classification. It's similar enough where it acts like the original Omicron. There were 99 strains of Delta.
Wow.
Nobody ever heard of it because it was all Delta. But there were 99 different variations of the variant Delta. I don't know how many they've counted for Omicron.
Yeah.
But nothing has been listed by the CDC as a variant of concern. So that's good. And that's only step 2 out of the 4 steps. So DEFCON 2, is that the
I
lowest?
think that's the, no, I think DEFCON 5 is the lowest.
Okay.
DEFCON 1 is.
So it'd be DEFCON.
I have to go
DEFCON
back
4.
to my War Games movie.
Yeah, right. So it's only, there are no variants of concern yet. Omicron is the variant of concern right now. Nothing's surpassing it, and nothing's going above it.
Yep.
Anything else? It's all you, Joe.
Nothing else, we need the motion.
Oh, motion to adjourn.
Second.
All in favor, say aye.
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 Unanimous.
Meeting's adjourned.
There you go.
We only have two of us.